I call this meeting to order. This is the fourth meeting of the Interim Joint Committee on State Government. I'd like to ask Madam Secretary, would you please call the roll?
Senator Alvarado.
Here.
Senator Harper Angel. Senator McDaniel. Senator McGarvey. Senator Nemes.
Present.
Senator Schroeder. Senator Southworth. Senator Storm. Senator Thayer. Here. Senator Wheeler. Here. Representative Blanton. Here. Representative Bowling.
Here.
Representative Cantrell. Representative Decker. Representative Duplessis.
Here.
Representative Fisher. Representative Flood. Representative Gooch. Representative Graham.
Here.
Representative Heath.
Here.
Representative Heverin.
Present.
Representative Heron. Representative Imes.
Present.
Representative Johnson.
Present.
Representative Cook.
Here.
Representative Derek Lewis. Representative Scott Lewis.
Here.
Representative Maddox.
Here.
Representative Mentor. Here. Representative Moser. Representative Nemes. Here. Representative Scott. Representative Smith. Here. Representative Stevenson. Representative Tate. Here. Representative Tipton.
Here.
Representative Upchurch.
Here.
Representative Weber.
Present.
Representative Wheatley.
Here.
Representative Bratcher.
Here.
Senator Mills. Here. Representative Miller.
Present. We have a quorum duly constituted to conduct business, and we still have the minutes of the July 19th meeting to approve, so I'd ask for any motion. Motion to approve. Second. We have a motion and a second. Are there any comments, questions? All in favor of accepting the minutes as printed, signify by saying aye. Aye. Opposed, like sign. The minutes are approved for July 2019. Now we have the approval of the minutes for August 25th, 2022 meeting. Can I have a motion? We have a motion and a second. And all in favor of accepting those minutes, signify by saying aye. Aye. Opposed, like sign, and those minutes are approved. The first topic on the agenda is the 2023 Kentucky Employee Health Plan. Every year, either in September or October, we hear from the Personnel Cabinet on the changes anticipated and being pushed forward. And I'm sure, like most of you in this room, you've received a letter that the changes are on the way, and October 10th, I believe, they start. So please introduce yourself, Commissioner.
Yep.
And Deputy.
Okay. Mr. Chair and members of the committee, I'm Lindy Casper. I'm Deputy Secretary of the Kentucky Personnel Cabinet. And with the resignation of Commissioner Raina Dempsey Diaz, she is retiring effective last week, and we have a new commissioner effective October 1st.
Pull that mic up closer to you, or turn it on, one or the other, or both.
Okay, the green light's on, so I
Thank
guess
you.
I need to pull closer. So we have a new commissioner and deputy commissioner effective this Friday.
Great.
And the new commissioner is Sharon Burton, and I'm honored to introduce her. She began her career with state government in 1994 at the Department of Insurance, serving as legal counsel, general counsel, and director of the Health and Life Division. In 2013, she joined the Personnel Cabinet, serving as legal counsel for our branches and departments that provide a variety of employee benefits such as life insurance, workers' comp, and Kentucky Employees Health Plan. In July of 2020, she became the Deputy Commissioner of DE&I, and effective this Friday, she'll become the Commissioner. Chris Chamness brings a wealth of experience to his position. He brings his experience with regulatory and compliance in the private and public sectors. Before joining the Personnel Cabinet, he gained diverse experience in the legal arena in Washington, D.C. and Maryland. He's held management roles with the U.S. Department of Commerce and the U.S. Census Bureau in Lexington. He joined the Personnel Cabinet in 2021, and effective this Friday, he becomes the Deputy Commissioner of DE&I. So I'm proud to present Sharon and Chris for their presentation.
Thank you, Mr. Secretary. Commissioner?
Yes. I'm Sharon Burton, as the Deputy Secretary indicated, and Chris is going to begin our presentation.
Yes, and I'm mindful of the committee's time. I'm going to be going quickly through these background slides, but of course, if any of you have questions, please just stop me. I'm happy to answer them. Starting off, just a quick overview. As you see, school boards represent a majority of our members, followed by retirees under the age of 65, state agencies, and quasi-governmental groups. Membership continues to be geographically diverse, with members in every county of the Commonwealth. This presents a challenge when we consider benefit programs, as we have both very rural and very urban populations that may have different needs and priorities. So, for example, one of the things we consider is internet connectivity in rural areas when we talk about programs related to telehealth, for example. We've seen plan holder numbers decline slightly over time. As plan holders decline, so do premium receipts. Declining membership may lower total claims proportionally, but it could also be a financial pressure point for the plan, especially if lower membership changes the risk pool. Our hope is that we're going to continue to see enrollment of at least a similar percentage of younger and healthier members to help defray the claims risk, but time will tell. Looking at the covered lives trend, so this includes spouses and dependents. After seeing an increase in total covered lives in 2020, we have seen a decrease in the 2 years since, mirroring our other plan holder numbers. Net payments and claims by year. Although membership is decreasing, average net payments per claim continue to grow over the years. Year 2020 deviates from an otherwise consistent trend here of rising payments and claims year over year in recent history. That deviation is likely due to COVID. Our actuarial consultants expect the trend of rising claims to continue. The Commissioner will talk more about that in her session. Related to plan expenses, this image should be familiar to many of you. It reflects how we are maximizing the use of premiums to provide coverage to members with low relative administrative costs. Claims payments reflect a large majority of plan expenses. This really reflects our values at DEI, namely to provide quality benefits and coverage to our members while taking a frugal and careful approach to finances for the plan. This slide here reflects aggregated KEHP claims and data cost trends, showing that the financial trends for the plan over time is broadly tracking the broader health insurance market. We did experience a downturn in 2020, but a rebound in 2021 that we expect will carry into 2022. The Commissioner will now explain our projections and financials for the remainder of 2022 and beyond, as well as highlight some specific programs for members.
So when we consider what we're looking at in 2022 and going forward, one of the things we're watching is price inflation, which can show itself in higher wages in the health care sector and even specialty drugs or non-specialty drugs. So chronic conditions is also something that we keep an eye on regularly to see where our expenditures, our largest expenditures are. Spending around chronic conditions in terms of prevalence and increasing costs continues to drive medical and prescription drug costs upward. Behavioral health is something else that is another area where we've seen continued increase in utilization. That's a good thing. That's positive. It's just a small subset of our yearly expenditures, but we are watching that utilization grow. Traditional drugs, that's on the list because There are no impactful generics in the pipeline that would defray the cost of brand drugs at this particular time, so we hope that changes. The good news is for 2022, our claims experience is favorable. It's better than what we had projected. At this point, we don't know that if it's because of the deductibles and maximum out-of-pockets that reset at the beginning of the year, but the time will tell again, and we hope that favorable trend continues. For 2023 plan year, we're grateful and thankful and appreciative of you, the legislature, for passing in your budget the 10% employer premium contribution increase. That helped take the burden off of the employee, and and to the extent that we were able to keep the employee increases static, so there will be no employee premium contribution increases for 2023. Also, no changes to copays, coinsurance, deductibles, or maximum out-of-pockets. Another thing that we did is we eliminated the Living Well high deductible plan. To be honest, that wasn't a great plan. It was a plan that we had put in as our default plan. When we compared that plan to the Living Well Basic CDHP plan, the premium differential was very nominal compared to the increase in benefits you got with the basic plan. So we eliminated the high deductible plan, and the Living Well Basic CDHP with no HRA funds will be the new default plan for employees who don't affirmatively enroll. I just want to highlight a program that we put into place when we took a look at our musculoskeletal condition spend for 2021. That spend was just a little under $200 million. So we wanted to do something to address that and try to decrease those costs. So we implemented in March of 2022 Hinge Health, which is a digital, at home, in the office physical therapy program. We have currently 5,560 members enrolled in that program, which is really good engagement for our health plan. And we did a 12-week review of that program, and on the right-hand side of the slide, you'll see that those that were engaged in the program indicated that they had 52% pain reduction, 66% surgery reduction in surgery likelihood. There was an 82% reduction in anxiety and a 79% reduction in depression. So we're excited about those results and are looking forward to seeing, what the rest of the year holds for that program. Just to highlight what we're doing on the behavioral health side, as I indicated, utilization for behavioral health is increasing, and it's increasing year over year. So I wanted to highlight some of the programs that we have that are resources for our members. We have Live Health Online Behavioral Health, where our members can access a therapist. They can get appointments with therapists online, so they don't have to go to brick and mortar to have a session. Learn to Live is a digital tool that is administered by Anthem that allows for personal coaching, and it helps members learn effective ways to manage stress, depression, and anxiety. The Resource Center is a 24/7 hotline where our members can access experts in the behavioral health field, and they can find resources and doctors for treatment. Rethink Care is a program that is for caregivers of children who have behavioral challenge or developmental disabilities. They also have 24 access to dedicated behavior experts, and they have a vast array of resources through the Rethink Care website. Lastly, I just wanted to touch on diabetes. These programs have been in place for quite a while with the health plan, but I wanted to just touch on them so you'll be aware that we have our value-based benefits where our members can bypass their deductible and they have reduced co-pays and co-insurance for their diabetes medication. And of course, we also have the $30 maximum copay for a 30-day supply of insulin. LARC is available to our members with pre-diabetes. That's our diabetes prevention program, and that's administered through Anthem as well. And last year, we implemented a no copay for diabetes self-management education and support programs. We haven't had a lot of uptick in usage, even though there is no copay, but we are working with the Cabinet for Health and Family Services to educate and engage our members in that program. So lastly, I just want to say that the Kentucky Employees Health Plan is a $2 billion health plan, and it takes a lot of work to collect premium, administer benefits, field consumer issues, reconcile and pay vendor invoices. So a lot of work is being done at the Department of Employee Insurance. We're proud of our health plan. We hope you're proud of our health plan. And we constantly are reviewing programs and coverages to make sure that we're fiscally responsible while taking care of the needs of our members, and Chris and are committed to continuing to do that.
Thank you for that presentation. I have some questions, I'm sure, and the first one will come from our representative from Franklin County.
Thank you, Mr. Chairman. Of course, in my district, this is very important. And first of all, let me thank you all with our state employees getting a cost of living increase and holding the amount of health insurance. That's a great thing because they're able to keep what the state is going to provide them. So I want to take the opportunity to thank you all for getting this. And I just wanted to I'm looking at the first, your plan holder enrollment trend. And you show that you have 6,000 fewer plan holders for 22 than there were for 2019. And you may have said it, but is it because some of our employees are taking on their spouse's insurance, or what is the cause? I mean, you may have said it in your presentation, but if you can repeat as to why you have such a tremendous amount of plan holders. For the year.
I don't know if Chris mentioned the why. I mean, we have some assumptions. I think part of it may have been the Great Resignation that we all hear about. So we have fewer employees employed.
Right
And there also could be instances where folks are also going to pick up insurance through their spouses. Yeah, but we for the most part think it's just a reduction in the employee population.
And we knew that we were losing a lot of people during the pandemic.
Right.
So thank you so much. Thank you, Mr. Chairman.
You're welcome. Senator Southworth.
Thank you. I know that those different member plan special things that you listed up there, the behavioral health, the whatever, I'm also thinking of the pilot project for acupuncture in Lexington that I became aware of, I think maybe a little over a year ago that was coming. I think we're still ongoing. Actually tried to make an appointment. I don't know, never got a call back. I really want to try calling them again, but I don't think we can figure out how the pilot went if we don't know how to use it. And perhaps these are going out in personnel memos to all the executive branch employees, but are these going out? I don't recall, unless I'm just not seeing them in my emails for all the LRC. We are obviously all members as well. There's a lot of people in here that aren't executive branch employees that are still KEHP members. Are we getting, quarterly, monthly, at least annually updates? Here's all your resources and the links and the latest pilots we're doing, or do you just need to be a legislator and happen to be in this meeting?
No, I mean, we communicate often. So I'm a little perplexed why you might not be receiving those. It makes me think that maybe we need to look at where our delivery system is to make sure you are getting them. But I would say practically every week we're sending out an email of some sort to our members. So I'll certainly look into that to make sure that you're on the list and the whole legislative committee is on the list, and they're getting those.
Okay, thank you.
Just to follow up briefly on the acupuncture program, because you did mention that program is indeed ongoing. I know that they have had some staffing changes over there, but to the extent that you have trouble getting a hold of them, by all means, reach out to our member services hotline, and they can try to force through a communication to be sure that they're responsive. That should be their role, to get back in touch with you so that you can set an appointment.
Okay, thank you.
Great. Senator Alvarado.
Thank you, Mr. Chairman, and thank you all for the update on the employee health plan. My biggest question comes on prescription claims and pharmacy benefit management. We've done a lot of work here in the state on PBMs, and we've uncovered a lot of, I think, abuse within our Medicaid system, and probably what it's looking like is hundreds of millions of dollars in savings to taxpayers and to our Medicaid system. So obviously that's one of the focuses I think we're going to be looking at. We had a House bill passed in the House. I think it didn't pass the Senate. House Bill 457 last year. That I think would have done this beyond just Medicaid. Throughout the entire state would have been, kind of looked at this. We also passed Senate Bill 178 looking for an RFP to start taking a look at our employee health plan. I wanted that to go broader, but it was specifically for this program as well. Hoping you could speak as to how, I take a look, we have less people in, but our costs on pharmaceuticals, I think, are staying about the same, or they might be a little bit less, I guess, on the number 7 on your past trends there for medical and pharmacy trends. But just how do we have that right now? Because I think we're going to have a presentation tomorrow in Health and Welfare that might open some eyes on how those numbers are looking for the state employee health plan, and how much savings there could potentially be if we brought that back in underneath us and not defer that out. So if you could speak as to the relationship of what we do with our pharmacy costs. Do we turf that to an insurance company to do that for us, or are we contracting for that in this system ourselves?
We contract with a PBM. CVS is our PBM that administers our prescription benefits. We have several different programs within CVS that the goal is to reduce the cost and get savings from how they administer our health plan, the prescription drugs. We have Aon at CVS right now doing a market check, and we do that every year to make sure what the health plan is paying for drugs is what the market says we should be paying for drugs. So that usually results in significant savings when we get ready to go into contract renewal in 2023.
Excuse me, Commissioner.
Yes.
If we could all get back on page 6 of your slides. Prescription administrative expenses, 0.5% of premium, and that's the AON and the Caremark cost of the 28.1 prescription claims.
That's just the administration expenses that we pay to CVS for like $1 a claim, $1.50 a claim. It doesn't really have anything to do with the drug prices. The prescription claims, 28.1%, that is the prescription drug prices that we are paying.
All right, thank you for that clarification. Senator, do you have?
Yeah, just really quickly. So again, I'm just curious to know, how do we know how much transparency is there? Because we haven't had much of that when it came to our Medicaid programs. When we asked for that information, a lot of resistance from them providing us that. We had to pass a law to get that information out of them. And then when we uncovered it, hundreds of millions of dollars in savings. And so that can be buried underneath the prescription claims themselves, plenty of negotiations that they make behind the scenes that isn't passed down to our consumers. And that what we see is with these PBMs, they'll negotiate a bundled rate, some kind of reduction. They're the ones who get that. And so these 28.1% in claims, we may have employees who are paying full price for a drug, and that none of those savings come back to them when they go ahead and purchase that drug. And I think we're going to have some testimony tomorrow. I think that you'll be interested in maybe watching to see I think we're going to have to be looking at reforms statewide, not just for Medicaid, but across all insurance lines, across the state employee health plan. Because I think we're all being taken to the woodshed by a lot of our partners on this who claim to be doing things in the best interest for our employees. You probably could save more money for our employees if we brought this back in and uncovered a lot of this. So I would encourage all members to watch tomorrow.
Yeah, and I would say in that regard that we would welcome some reforms with respect to PBMs and would hope that we're at the table when it comes to what those reforms look like and how they may impact the health plan. So
certainly, but again, as a member of the executive branch, this is something within your purview as well when you negotiate these contracts to require them to expose a lot of this, because we put a lot of trust into these folks, and they haven't always been honest with us. And
Well,
so
we,
I think it's really important that we take their word for it. I don't think they're often honest with those discussions. I would encourage you to peel this back, because you can get a lot of savings for our employees when it comes to their pharmaceutical costs.
Yeah, and I don't disagree that it is within our purview, and I believe our contract is very transparent. Could it be more transparent? Yes, it could. And we are actually getting ready to go to RFP for our PBM, and we're looking at the different models that are out there and models that may or may not be compatible with our procurement code. So we are researching that, and hopefully we can find a model that works for us.
Yeah, as the commissioner mentioned, as part of that process, we are talking to other states as well to learn some best practices. The DEI has membership in a couple of industry organizations where PBM transparency is a frequent topic, Senator, and as you point out, rightfully so. So we are willing to think outside the box when it comes to contracting time and make sure that we expand upon the audit rights that we already have in our present contract, as well as expand transparency.
One thought might be that if they're negotiating contracts behind closed doors, instead of them getting those profits, that money goes back to the consumer at the time of purchase of that medication. And that could be something that could be easily put into a contract to say if they've negotiated anything behind the scenes, no one ever gets to see those contracts, but that money doesn't come back to the consumer when they pay for that medication. They keep those savings as part of their margin. So it goes maybe even beyond the administration expense. It's probably a lot larger than we realize. So I think that's something that maybe in future negotiations you put that into contracts. And anything's negotiated, a large percentage, 75, 80, 85% of that goes back to the consumer at the time of purchase of the medication. Thank you, Mr. Chairman.
Very good. We have Senator McDaniel.
Thank you, Mr. Chairman. Commissioner, welcome. I'm to your right, kind of right at center of top.
Here you are.
Good to see you. So I wanted to shift gears just a little bit, and I don't know that there's necessarily a question here so much as a statement, and I'll try to not make it an extended one. And the idea is that the best drug you can ever have is the one you never need. And to me, societally, we're making it, and have been for 35 or 40 years. This is not a criticism of you guys, but we've been making a huge miss. The very basics of preventative stuff, basic diet and exercise, the things that all the data will bear out has effects on mental health, joint health, heart health, lung health, diabetes. I mean, 1,300% increase in diabetes in the last 40 years in the nation. All these things, it's demonstrable. And yet we want to push the benefits of the plan, but we, as a society, we do a very bad job of pushing the benefits of individual responsibility for your own health and avoidance of being in some of these scenarios. What can we do to be better about that and to start that conversation in a more deliberate manner that there's things that can happen way before you have to get to some of these sad eventualities that are good for you and, necessarily have to result in savings for the plan as well.
Right. So we have a wellness program, and we're constantly looking at that program to see, is the money we're putting into that program really helping us on the back end? I totally agree with you. What we have as a problem in our population is the willingness to engage, to go to your primary care physician and get your preventive care. I totally agree with you that is a focus that we need to take. When we're looking at chronic conditions, what can we do before we get to a $200 million spend in musculoskeletal conditions. So I absolutely think that is a priority for us that we need to concentrate on and get people into their physicians so that they can early detect conditions that might be thwarted eventually. So.
Certainly, and to the extent that there's ever any way we can be helpful in that, I think it's a societal thing. Like I say, it's not a comment on KEHP or your leadership or anyone in particular. It's just a de-evolution that we as a society have made, and I think we could probably control or contain 90% of what it is that you guys have to do at a very low level of input from the basic consumer and it's just a larger conversation I hope we all can keep having.
It is a larger conversation, and I go back to the numbers for Hinge Health. I mean, for us, for a program that just began in March of this year, to have 5,500 people already enrolled in that program, that's significant for us. And I don't know why, but I think it has to do with the fact that Hinge Health sends you a portable laptop that you can do your therapy exercises in your office or at home. So the member doesn't have to go out and seek a provider and keep going and losing work time. So maybe it's a convenience issue. I don't know. But yeah, I agree with you. It's something that we need to concentrate on.
Thank you. Thank you, Mr. Chairman.
You're welcome. Representative Duplessis, did you have a point?
Yeah, I just want to make a quick point. Thank you, Mr. Chairman. I kind of wanted to piggyback on Senator Alvarado's comment in regards to PBMs. I've been told by some drug executives, company executives, that oftentimes rebates that are intended for the end consumer are cashed in by the PBMs, never making it to the consumer, which is obviously not the intent of a rebate. I would hope that as you're doing future contracts, that your contracts would stipulate that any manufacturer rebates go to the consumer, because they're cashing in on these, I'm being told.
So rebates come back to our health plan now. There's supposed to be 100% pass-through of rebates back to the health plan. That is several $100 million that we put into the trust fund that we use to keep premiums for everybody down. So we like that model. Passing it to one consumer at the point of sale doesn't help everybody in the health plan. It's just going to help the high utilizers of those drugs that actually get the rebates. So now, are we getting 100%? That might be another conversation. But that is what contractually we are supposed to get.
Thank you.
Co-Chairman Mills.
My question's on slide 9, on page 9, and we just kind of real quickly talked about this, but 10% employer premium contribution increase, but yet no increase in employee premium contribution, no changes in copay, co-insurance, deductibles, maximum out-of-pockets. Can you explain your thought process where if this was my business and I was facing a 10% cost to keep insurance in place, I think I'd probably be looking at the employee a little bit. So could you explain that, what your thought process was on that?
Sure. So statutorily, the health plan is put in yearly silos. You have to bring in as much money in 2022 as you're going to spend. So that's how the health plan is managed on a yearly basis, because that's how statutorily we're set up. If we make a lot of money one year, we can't go back to 2022 if 2023 looks really bad. We have to ask the legislature to get in go back and pick up some of that surplus. So we're managing the health plan on a yearly basis. So based on the employer premium contribution increase that was allowed for us, we believe the projections are saying we're gonna break even without having to put a burden on the back of the employees who have had premium increases and changes in co-pays and co-insurance over the last several years.
Great. Are there any other questions we have? Seeing none, thank you, Deputy Secretary, Commissioner, and
Thank you.
Deputy Commissioner. Thank you for your annual presentation, and if anyone has any follow-up questions, I'm sure they'd love to have those directly. Thank you. Next item on the agenda is a follow-up on the Kentucky Registry of Election Finance Software and Systems. We heard last meeting from Mr. Steffen, who is in the audience, I believe. Yes, there he is. But I'd like to give this opportunity to the vendor, Kentucky Interactive, to provide their context. Welcome, gentlemen. Please introduce yourselves.
Thank you, Chairman Miller. Can you hear me? Sorry. Thank you, Chairman Miller. First, we'd like to thank the committee for inviting us here to provide a follow-up for the campaign finance reporting system. My name is Carlos Luna. I'm the general manager of Kentucky Interactive, and this is Judge Palmer. He's the director of technologies.
Great.
Our goal here today is to provide three things: a project update, which gives the status, challenges, and some system strengths, as well as to highlight some system end user feedback, as well as to give you some project resolution plan. So when we started the project, we started off with 89 requirements. And since or after the execution of the statement of work, the requirements have increased about 594 more requirements, which gave a total of about 683. That's not typical for your everyday solution or development life cycle. Typically, when the scope grows, as you can see in the triangle, the time and cost does increase. And I just have you know that we have never increased the cost of anything that we've built or any of the requirements that we've added. The statement of work, or SOW, was broken up into 4 milestones. Milestone 1 was delivering the candidate filing dashboard along with some back office or the KREF agency component of accepting those filings. That was delivered, KREF accepted, and paid. Milestone 2A was the committee portion, so allowing the committees to be able to file and be received in the back office as well. Also delivered, KREF accepted, and paid. Milestone 2B is the public search. That one is where the public goes and searches for the information that has been submitted to the agency and released for public consumption. That has been delivered, waiting on acceptance, and has not been paid yet. And then we have the final 2 milestones, which are the remaining back office functionality, which will include some of the audit functionality, the legal portions, which we have already began development on and are close to presenting that for testing. The final piece, or the milestone 4, is the mobile application, which will be done once the whole system is complete, so that candidates can, at fundraisers, go into their mobile app and add the transactions as they are there. And not have to go back to a computer to enter that information in. The operational support of our agreement normally starts at the end of the contract, at the end of the completion of development. That we decided to implement that ongoing so that we can continue to address some of the scenarios or user stories that did not go into production when the original requirements were provided. And then lastly, the legislative changes from the 2022 General Assembly, those were delivered, those were made in a timely fashion, KREF accepted, and we're still waiting on payment for that. So let's talk about some of the challenges we've had and why we are here today. Initially, we had historical legacy data challenges. The data that was initially captured by KREF in their system had gaps, did not have the complete information. And so when we went to import that information into the public search capability for the public, it provided inaccuracies or not so much inaccuracies, but a disparage in data that made things look a little different or incorrect. We have since overcome that to some degree, where to most of the degree, where now we either behind us or we've added exceptions in the code to be able to exempt those type of data from being calculated into the new information, so that the end users are getting more accurate data. Agency process improvements. All right, moving from paper to online is always challenging. That became a challenge because as end users are used to going into writing on paper, submitting the paper, and then KREF contacting them to determine whether it has been accepted or not, that was could be a lot quicker. Right now, the system, we're building the system as requested to be able to control or restrict the information, make sure that the information that is being sent to the agency is complete. That way it prevents you as the end users or any other end users from having to go back and resubmit information or amend it. So there are various validations or requirements that require the end user to make sure it's complete before they submit it. The original scope changed, scope creep we call it in the IT world, from various factors, right? It caused us to have to rework some of the development functionality. So if we develop a specific function that wasn't taken into consideration for a specific user group, then we have to redo that work to be able to make sure that it can accommodate all of the end users that are using it. We build a system to the requirements that are provided to us, and we test it, the agency tests it, but sometimes when it gets to the public tries to do something that they aren't able to do, then that's when the rework comes in. The software development cycle increased, and the delivery times increased. Some of the system strengths. So with campaign finance reporting, you can now enter in your transactions as you are, or gather the information for the contributions and expenditures as you receive them or as you expense them. You can put them into the system, so when you're ready to go, ready to submit the report, you're ready to, at the click of a button, submit the report. The ability to route electronically for countersignatures. So if a typical treasurer is not in the same building as the candidate, which probably is common, then you don't have to run or route that paperwork over to the treasurer. You can just click the button, send it, electronically sign it, and automatically the notifications go out to the intended users to be able to sign it electronically. And the system also, again, ensures the proper collection of necessary data. So if it's going to require the end user to put in as much information as required by statute, regulations, and or business processes to be able to accept that information before they actually can submit it. The public search, it instantly, once a user files a financial statement, it automatically gets populated to the public search. That allows the public to see the information as it is submitted. Historical data is also available in one search now. You have the historical data. Again, when we had to import the information, we had to create some exceptions so that the old data didn't dilute or affect the new data, and those have been implemented. And the data is exportable. So you can export the data, reporters or just the public can export data and kind of put it into a spreadsheet and move forward from there. The next we want to talk about, and I would like to thank the legislative members that met with us to provide us feedback and the end users that met with us to provide us feedback. We'd like to talk about some of the feedback that we did receive with regard to how we can make the system better with KREF's help. 3 key features were adding a print functionality to the report before submitting it. We got that feedback quite a bit. And when advancing to the general election from a primary, the contributors don't actually move forward with that. So that is all we have to do, is make sure that the contributors that you have entered in the primary are available for selection when you're entering them in the general. Also, on the same lines, the expenditures currently don't have that capability. You're just not allowed to store the information of your particular vendor. So if you're making a payment to PayPal and you continuously make payments to PayPal, every time you enter in a transaction, you have to add it over and over again. You probably memorize the address for that part, for that matter. But that is something is also on the list to be addressed. So the rest of the feedback, as you can see, is here. And while some of these the majority of these are in the queue for being handled or being taken care of, we've been working closely with KREF to handle the high priorities to make sure that a filer can get the information, that if the information is not available to the public, it is made available immediately. So we work on the higher priorities in coordination with KREF to make sure that that is done. But having met with the legislator, having met with the end users, system end users, we want to try to work with them to make sure we can simultaneously add these features as requested. As far as the public search, it's got two major issues or feedbacks that were requested, and that is to make sure that the public information is available, complete, and reliable, or available instantly, right? So if someone submits a financial statement, the public wants to make sure that the data is there as soon as it is done, and if you're looking for an opponent information, you want to make sure that it's there because you filed yours on time and yours is out there, but the other one is not. So we've implemented some retry functionality to try to make sure that network disruptions or any type of nuances that occur on the internet do not prevent that from happening, or to help prevent that from happening. And the other key thing is improving the user interface, making it more intuitive. We're also working with on a plan to make that more intuitive, have a new user interface that it makes it easier for users to do a simple donor search of a zip code and find out who's donated to a specific candidate. Well, that brings us to our resolution plan. We are committed to continuous improvements. We want the system to work. We want the system to be useful to not only the end users, but also to the agency KREF. So while also trying to make sure that it meets KREF's statutes, regulations, and business processes. We're going to work closely. Our goal is to work closely with KREF to streamline the delivery process of the remaining items, the last two milestones, while also applying new project management methodologies to help minimize some of the issues that the end users have seen, as well as the agency. We will work with KREF and the end users to make sure that the campaign finance reporting is intuitive. We get that. We've heard that a lot from end users as well as from the agency, that it is not intuitive. It's not easy to maneuver. We want to help communicate FAQs, frequently asked questions, and help tools while you're in the system, maybe even collect some feedback while you're submitting your report to help establish what these intuitive ways can help, how these intuitive ways can help. And lastly, we are going to continue to add necessary or allocate necessary resources to address the new feedback that has been provided to us, as well as any other feedback that comes along with it, to try to make sure that we continue to address the end user's needs as well as address the issues that are arising on a daily basis. We want the committee to know that Kentucky Interactive is committed to completing this project. We're here in a way, we want to make sure that it is useful to both the end users as well as the agency, KREF. We're open to all feedback. We like to hear the feedback from the end users to help make the system better. We still have to go through the agency to make sure it gets deployed or implemented, but we will be the advocate if we need to be. And we're professional at all times, and we have successfully worked with over 300 agencies in the Commonwealth, so we want to continue to do business with you guys.
Okay. Thank you for your presentation, Mr. Luna. At this time, I'd like to ask Mr. Steffen, do you want to respond to questions, or would you like to make a statement? The chair will give you the opportunity if you want to say something now or just at the end. I mean, I'd like you to come up if you'd like.
I'll come up. And I've got my Teddy Boone, my IT specialist, is also with me if we need.
Microphone, please.
Yeah.
Introduce yourself formally.
John Steffen, Executive Director.
Mike.
Oh, now it's green. Now it's lit up. It looked green. Okay, John Steffen, Executive Director of the Registry of Election Finance. And with me in the audience is Teddy Boone, my IT specialist, in case we need to hear from him as well, or if you have any questions for him. Again, I appreciate the opportunity to speak to this group. Just talked to you last month, and kind of had the opportunity to express my concerns. So I'm glad you have a chance to hear from Kentucky Interactive today. I wish I could say, and I just got this packet when I walked in the door today, but there's not a lot of new information in here that I haven't been hearing for a while now. You know, we're talking about a project that should have been done 2.5 years ago, and I think that's the big picture you all need to keep focused on. Is this project should have been done and over with a long time ago. If we're still working on it, it should be making improvements based on user feedback, not trying to take user feedback while we're still trying to build the system. So I think everything we talk about needs to be framed in that. This thing should have been done a long time ago. And if we're still having issues with it, then we make improvements. Or there's legislative changes, we make those changes. But that's not where we are, and that's where I'm kind of wondering if we're ever going to reach that point, as I said last month. I'm just going to address, I mean, I could address a lot, but just a few points. I've seen these numbers before about the statement of work requirements increasing so much. I remember we looked before, we didn't really find it credible. I think probably what happened is we had 89 requirements, and then nested within those are these other 594. Maybe, you know, we worked with their team for a good 9 months trying to develop the scope of the project before we ever entered into an agreement with them. If the scope wasn't where it needed to be, at that point, I don't know, you know, whose fault that is, but I do believe we've identified more work, but it's all been under the umbrella of the original statement of work. The milestones we have, like was said, accepted and paid for the first two listed here. I will tell you that 2A we accepted and paid for knowing there were still issues. We had their assurances they would continue to work on those issues. We felt like in good faith we should give them a payment because we realized they had been putting in work on it, and we hoped that by paying them we would keep the work going. So that's why that payment was made, even though there were still issues, and there are still issues with the 2A milestone. And there's a lot more details under these milestones. This is just a high-level thing they put here. And no, I haven't paid them for milestone 2B because we're still waiting to get through a reporting period with no problems, and we just had another reporting period. And I've got a list of the problems that were actually keeping people from filing this time. For just before I came over here, I had a reporter call about some issues in Northern Kentucky. And I was like, you know, that's not on those candidates, it's on the system because those reports weren't available for them to file. So we keep seeing the same problems each reporting period, and I will keep not paying until we see some, and we've told them this, until we get through a reporting period without all these problems. I don't personally think I accepted the legislative change. I don't think they're unpaid because I don't think everything there is still working, but we're still racked with the problems we were racked with when I talked to you last month. This was going into the discussions with Kentucky Interactive originally. The way they work was described to me as, I forget the term for, is a back and forth process. So I think a lot of what we've been doing is how they operate, which is fine, is you know, they put something out there, we test it, we review it, we go back and forth to assure that's working right. And I'm not complaining about that process, but it's almost like they put that out there as part of the problem, but that is actually how they do their projects, and that's how we've been working with them. It's just we never seem to get past some of these same points of problems that we keep seeing. And I'm not gonna hammer on all this, but the suggested improvements, the first one on the list is to be able to view and print financial statements. That was identified as a needed enhancement 2.5 years ago in the 2020 primary. It's still not done. I think that highlights kind of how this project has gone. It's still a suggested improvement 2.5 years later, and it's the first one on their list here. The suggested improvements to the public search, I think being available, complete, and reliable are expectations, not improvements that it should have. Again, I'm not going to go through and pick the whole thing apart. We're still facing the same problems we faced. You all use the system. You know how difficult it is to use. You know the problems you have to overcome every time you try to use it. There are some good parts of it. Sometimes some things work successfully. The back office that I mentioned before, that our staff, we've been asking them to do something about it, make it more functional, user-friendly for us in-house for a long time. It's not there. Public search, the database still is not reliable. It still misses information. Sometimes it'll be there, sometimes it disappears. It's just been a frustrating project that I don't know how we're going to reach an end.
Okay, so John, essentially, you're saying there's not been a lot of change since
we're
you
still in the
spoke with
same.
us last month.
The only thing that's happened is we went through a reporting period, and
Well, why don't we go on to
was
questions
unsuccessful. Okay.
from members, and then allow Kentucky Interactive to respond, and then at the end of each question, you can comment if you choose.
all right, thank you.
Okay? So the first question is from Senator McDaniel.
Thank you, Mr. Chairman. Guys, Mr. Luna, Mr. Palmer, I do appreciate you guys coming today. Honestly, after the beating that John took last month, I don't know if I would have had the courage to have shown up. So at least you did that, and we appreciate it. That being said, let me jump into a fundamental misunderstanding, Mr. Luna, that you had made there, the idea that treasurers are in different buildings. A large reason of why this becomes such an emotional issue for us is a lot of us live with our treasurers. A lot of us have been our own treasurers, and a lot of us, every one of us, a treasurer is someone whose integrity we find to be unimpeachable because they are charged with the finances of the campaign for which we could be held liable for felony violations. And so these are people who, when they bring us an issue, we have the utmost of faith in. I mean, like I say, a lot of us are married to our treasurers, or they are lifelong, trusted family members, advisors, etc. And so when they come with the levels of frustration, because not a lot of us up here are IT people, but most of us can go on Amazon and fill out forms, or have to do Google surveys, or have to input data elsewhere. And, you know, for a normal level of frustration might be here with any given system, right? We all have to do this with work or whatever the case is. It's like here with this system. And at the end of the day, we know results, and the results aren't what we expected. A lot of us took things back home and told people this is going to be better because of this thing, particularly the folks that were getting campaign contributions late in the cycle. You know, you will have better information, and it's still not delivered there. And I want to comment on just one thing that jumps out at me, this idea that there have been 594 changes, but you guys haven't made any request for additional dollars. So being in the construction industry like I'm in, we deal with changes all the time. It is a regular thing. And when I don't bill or ask for money, there's only one reason for it. Either A, I missed the fact that somebody had changed something, or B, it's inconsequential and I just figure I'll absorb it as part of the cost of doing business. And so this feels to me like we're scrambling for reasons why, when at the end of the day, the performance simply has not been there. And I guess, in my opinion, and I get to my question now, Mr. Chairman, I apologize for the diatribe. You guys basically are on kind of a 45-day glide path to crash and burn or get it right. This election's it. And I want to know where you're going to be and specifically how you're going to be there. I mean, do you have 15 developers working 24 hours a day, 7 days a week to make sure this is going to happen? I mean, because I don't, mercifully, I'm not in cycle right now, but the stories I get from my colleagues and their treasurers who are, make me very nervous about what it's going to look like for the 23 and 24 guys. So what's going on specifically that's going to give us confidence that this thing's not going to flame out after the first Tuesday in November?
Well, Senator, actually, I wanted to address I'm not sure if this is on. Let me scoot up. I wanted to address your concern about the payment. It wasn't that we didn't request more payment, it's because we were told no. So instead of us walking away and saying, fine, we won't do business with you, we still continue to deliver because we have a commitment to our partner. Whether they pay us or not, we don't walk away from our partners. We want to make sure that what we do is delivered and that we continue to deliver on what we promise. So I just wanted to address that question.
Okay, I'm sorry, you're getting the other one. All right, go ahead.
With regard to what we're going to do, our goal, again, is to make the system succeed. And what we want to assure you is that, yeah, we are working on process improvement. We are working on adding additional resources to try to, fund it. 45 more resources, we may have, that may not be possible. However, we are going to add additional resources. We are moving resources around to make sure that we can meet this deadline and meet the goals that the committee and the agency has put on us to be able to submit and go through a filing successfully. I believe we have gone through filing successfully, but as we continue to build and develop into the system, there are certain features and functionality that we're requested to build that once out in production is when we find out something doesn't work the way it's supposed to because a specific scenario wasn't thought of or a specific scenario wasn't at the forefront of that thought or the forefront of that request. So we feel that if we could have some kind of forum with some of the treasurers, the family members, the longtime the friends or family, have some kind of forum with them so that we can see what the system is doing that is making their use of it so tremendous or so hard. We can work with that and talk with KREF, continue to work with them to try to address those simultaneously. That is our commitment, to try to bring in some more feedback from the end users directly so that we can address that and simultaneously work on anything that the system needs to continue to do or continue to complete on.
Thank you. Thank you, Mr. Chairman.
Representative Bratcher.
It just seems like there's a heck of a lot of lack of communication. I've met with both of you separately, and it just seems like maybe we should have all been meeting and talking about these things. There's problems with this system. Now, when big projects come out, there's always going to be bugs. I mean, that's just normal. You get a new fighter aircraft in the military, or you get a website. There's going to be a lot of bugs, but it just seems like this isn't user friendly, like someone said above that they use with Google or Senator McDaniel. And it just seems like the technology's there, but we're 2 or 3 generations behind on the technology. Would you address that? Is this up-to-date technology you're using? And then the second question, go ahead, and I got a second question.
So I can answer that. Yes, we are using up-to-date technology on this application.
Okay.
With regard to that, though, Representative, we're using up-to-date technology, but as we build a specific functionality or part of the system, what we're probably lacking is the end user input of, is that useful to me? Is that useful? Is it going to be intuitive for me? Because we're using the best or the most recent technology, and it dictates that an ellipsis, which I think is one of the challenges that, a lot of users have had, which is the 3 dots, the edit menu, is a common thing, but not everyone is not common to everyone. So that feedback is what we'd like to see and hopefully can get. And our goal is to add the resources to be able to kind of in parallel work with those scenarios as well as get the system done.
How would you like to get that feedback?
As mentioned, I think it would be beneficial to meet with the treasurers.
Every treasurer?
And get a pool. I mean, maybe.
So one of the other things that we thought about internally, but we haven't had a chance to mention it to KREF, is adding some type of comment feedback at the end of the submission process of, can you give us a star rating or enter a comment? What was your experience? What would you like to see different? What worked? What didn't work? So that we can collect.
Can I ask why you haven't told them that yet?
As we were meeting with system end users, including legislators, we were trying to gather the information, gather the feedback so that we could take it back to them. And some of the stuff that we heard as well is already in queue. So yes, our goal is to make sure that communication, that we work together. We do meet on a weekly basis with the agency. We talk about things that are in the queue working, things that are released for them for testing, so on and so forth. But that may have been one of the items that we need to get in front of them as soon as possible.
And last question, John, was there a pilot? Why not have had like 30 various people across the state volunteer, like, you're going to do it this way for 1 year, 2 years, and then if that pilot system worked, expand it more and more and more? Was there anything like that?
Well, it's kind of a two-part answer to that. As the system developed, and I still feel like we got started on it in plenty of time, it just didn't get anywhere at first. My idea was to have the system out there or test it, have users test it, user groups test it as we went along, but every time we reached the end of one of these milestones or important pieces of the project, it was time to get it out there for use because the mandatory electronic filing requirement came along before we finished the project. Now the time frame for finishing it should have been pretty much one and the same, but we lost some ground there where we could have had users test it because we had to get it live. We had to get it out the door as soon as things became available.
Thank you, John. We've got a lot of folks in the queue. I'm going to try to keep us moving. Senator Thayer.
Thank you, Mr. Chairman. There's a lot to unpack here. Members of the committee, how would you like it if a bill you spent 10 years of your legislative career working on, considered it a milestone piece of legislation, groundbreaking in terms of transparency and disclosure for the public, and 3 years after it passed, you're still having a committee meeting, listening to excuses about why the law, hasn't been properly implemented? Now, that's how I feel today. I was the sponsor of the bill that passed in 2019 requiring mandatory electronic filing. I'd been working on it for 10 years. Representative Wheatley, when your party controlled the House, all they would give me was mandatory electronic filing for statewide candidates. So that was a good step. But in 2019, things had changed and we were able to get the bill passed. It was a pretty significant step. Disclosure and transparency and accuracy of information is the cornerstone of campaign finance. I think that's an issue that we can agree on a bipartisan basis. But this has been a complete and utter failure, and I was pretty hard on John at the state fair last month. And so to be magnanimous, I'm going to be equally as hard, if not harder, on the vendor that was hired to implement this. Kentucky Interactive, you were warned 2 years ago in front of this committee that this system you developed was not working. And I don't understand here we are, and you're just now talking about wanting more feedback from end users. I mean, this is, if you were in the private sector, you would have been fired 2 years ago if you were dealing with a private sector company instead of a government agency. You've talked about, John's talked about, all the things that we know are wrong with the system. The inability to be able to print reports is huge. If you're not your own treasurer and you're relying on a treasurer to help you with this, and they can't give you a printed report to check the accuracy of the information that's been entered, how do you know you're providing accurate information? KREF has had to resort to urging candidates to provide fake dates to get the system to work. I mean, this is beyond the pale of what should be happening here. Just this morning, I received an email from a candidate's treasurer. They're still wrestling with the 60-day post-primary report and being able to accurately move forward the balance into the general election campaign. And it's almost October. I look at this PowerPoint as a work of fiction. If it were in a bookstore, I'd look for it in the fiction section, or maybe in the propaganda section. I feel like you're trying to do a Muhammad Ali rope-a-dope on us. Just keep pounding away, and hopefully we'll go away. Well, that's not going to happen. I think these are excuses. I think they're lame. You had 9 months developing this scope with Kentucky Interactive. I've been informed that all your personnel has turned over since the original scope was agreed to. It makes me wonder if you understood the full scope. Did you include product testing by expert end users when you were initially developing this software? Why are we still addressing these problems 3 years and a couple of election cycles after the bill was put in place? Why did you not respond to the concerns of this committee 2 years ago when we were saying the same thing then as we're saying now? Transparency, accountability, and disclosure in the campaign finance realm, my fellow members, has been dealt a blow, and that is exactly the opposite of the intent of my legislation that many of you who were here then voted for. Candidates from both parties are beholden to the law concerning disclosure and transparency, and there's an obligation to the public, the press, the political parties, and other candidates to ensure its accuracy. We've been dealing with an incomplete system now for 2 years. There is no accurate disclosure and transparency. We're putting ourselves and other candidates and our treasurers in a dangerous position of potentially breaking the very law that we voted for. All because we tried to do the right thing. We have to do something. John, I commend you for coming to our committee and taking your licks last month. And if I were you, I wouldn't pay these guys either. They're not delivering on what they promised. And how can you guys look us in the straight face and come with a fancy PowerPoint and say, well, we want to have more talks with end users? The bill passed in 2019. You spent 9 months developing the scope. We're on to our second legislative election cycle. Mr. Chairman, members of the committee, I think it's time that we cut the cord with Kentucky Interactive. And if we have to give KREF the statutory authority to do that, I think we should do it. And I'm going to reiterate the suggestion I made at last month's meeting. Next year, there are no regularly scheduled legislative elections. Of course, there is some races for some other offices that everybody keeps talking about, but my focus is on legislative elections. We have no regularly scheduled ones next year. All of us who are returning in January will be required to file one annual report that's due December 1st. Now, this is a big thing because I'm the sponsor of the bill. I believe strongly in transparency and disclosure, but I think we need to consider passing a bill with an emergency clause in January that temporarily suspends the mandatory electronic filing requirement for 1 year, allow us to file paper reports on December 1st, and give KREF the chance to start over. There are professionals out there with products that work. We need people writing this code who understand the needs of the end user. And guys, I'm sorry, I just don't think you did. And we've given you time. You were before this committee 2 years ago. And I raised concerns, and so did other members, and we're right in the same spot we were. And so please understand my frustration. This is an epic failure on behalf of the constituents who we represent, who deserve accurate and timely information about where candidates are raising their money and how they're spending it. And right now is the most important time for that, as people are getting ready to make their decisions about who they're going to vote for in November. So you can respond to any of this that you'd like to, or if you don't want to, that's fine too. Mr. Chairman, I appreciate your indulgence, and I wanted to be on the record and say that I believe it's time we give KREF the authority to start over with a product that lives up to the original premise and tenets of the bill that we passed in 2019. Thank you, Mr. Chairman.
Thank you. You're welcome to respond, or I've got 6 other questioners. So.
We can go on to the next questions if you want.
Okay. I'd like you to go have all follow-ups come through me because we've got a meeting coming in at 3:00, so I need to make sure that we don't impinge on the PPOB's time. Senator Southworth.
Thank you, Mr. Chairman. I have an initial quickie, and then I want to have a larger question, depending on their answer. I know Kentucky Interactive is not a Kentucky company necessarily. You guys have done work all over the country, I think. Do other states have KREF systems that you do not do, or do you do all the states?
We work our parent company works in various states, and we recently got purchased by Tyler Technologies. But we did the electronic filing system for the FEC, the Federal Election Commission, sometime back over a course of 13 years. That was a system that was built with as a phased approach, right? You allowed people to voluntarily file electronically while the system was worked on and continue to work and continue to get its updates. And once the agency felt that it was at a good position, then it moved into a mandatory electronic filing.
Okay. Now you would go ahead to your main question.
Yeah,
please.
what I'm trying to get to the bottom of, and I'm not sure that I'm still there yet, but I'm hearing all of this and trying to take it all in, and from last month to this month, what I'm seeing, I think, is that the language that we're using, like I'm hearing words like resources, and knowing IT talk, that means certain things that KREF may not think it means. And that's just a small example. But it looks like to me we're trying to build a system using bones, the 206 bones that we have in a body, and trying to make all of these little pieces work together when the end users really want something that has, tendons and ligaments and fascia and all this other stuff that makes cool swooping motions. And in my experience dealing with KREF and the website, it's not just been that the actual functionalities of the website don't work. It's that there's 3 different legal ways to do the same goal. And I'm not entirely sure how that gets put into a scope of work in the first place. So I think this is really multidimensional. I've always been underwhelmed with Kentucky Interactive. I mean, I've said that before. I always enjoy my meetings with Carlos, and then after that it goes to pot. But I just am really trying to figure out, is there a way to have a scope of work for KREF? Or is this a legal issue? Because there's not one path that's articulable into an IT framework, I don't think. And I'm just wondering if there's another state that has a system that literally works, then we need to copy and paste. Because I don't know how we're going to redevelop this thing. That's really my input, and we need to do something. And I don't think Kentucky Interactive with KREF's the only issue. I mean, it's always been an issue. But particularly in this situation, we don't have a 1, 2, 3 step of how it has to be, then we can't build a framework for it unless you have really cool tools that I don't know about. So that's really my input. We need to figure out, is it even possible? And if it's not, then we have got a long road ahead.
The
Comment, please, but I have a follow-up to that I'd like.
Actually, go ahead then, sir. Chairman.
That is, you mentioned on your second slide there were 89 requirements, and then it blossomed into 594 more. Has that list been given to John, and has John been able to go through that list to say, no, that was originally on my specifications?
It has.
Okay.
It has, Chairman, as well as, the feature for printing the report. That was never an original requirement. And so when it did come up, it's one of those things in the normal course of IT management or IT development that we create a change request and either we tack it on, extend the timeline or extend the cost or extend the project or put it at the end of the project when we're complete. And so those are the things we're trying to help address now because it's becoming overwhelming for the end users. Another thing with the end users is that as they are trying to use the electronic filing systems, there are a lot more restrictions on the system electronically that there have been on paper. You could put in a contribution, not put in an occupation, not put in an address, and they have to accept it, and they get it, and then they have to contact you back or the end user back to try to figure out how to get the remaining information. The system, per request, was designed to not allow that to happen. We need that information on the first go-round. And so those are some of the challenges. We've talked with them about changing them to warnings so that at least they can submit it and then and admins can reach back out to them and say, hey, look, you submitted this, but you still have a warning. You didn't comply with this, and to try to move things forward.
Let me interrupt here. John, it's been 30 days. I heard that before about making things warnings rather than fatal mistakes. Is that something that they've discussed with you and you would approve?
Oh, we've been asking for that for quite some time.
So
actually.
when can Kentucky Interactive fix that?
So
it's just a simple example.
And so, Mr. Chairman, we have been addressing that. As a matter of fact, we have already started those changes. We recently sent a list of the validations to John for him to be able to review them so that we make sure that any validations that's been added since then are included in that process. And we've actually already started making the changes to support that.
Okay.
But I think they wanted to wait until after this election before we implemented that. So it should be shortly thereafter.
Okay.
And
Senator
also-
Wheeler.
Okay, go ahead, sorry.
Yeah, I just, how much has Kentucky Interactive been paid to this point on this project?
I've got the numbers. We have paid them $314,517.82.
Okay, and how much are they claiming that they're still owed?
The remaining cost looks like $233,255.
So $500,000 for a project, and I met with y'all as well, and I get it. I mean, designing something from ground zero can be challenging, but I guess what kind of concerns me here today is that I've heard that you all claim to have had experience in this and that you developed this system for the Federal Election Commission. So given the fact that you've had that background, why has this particular system been so difficult to get right?
So I can answer that question. So part of the difficulties that we've had is from the initial start of the system, it was developed off of their legacy system. So they had internal process. So if you imagine that when they were handling paper process, how they would enter data was completely different than maybe a web user would do it, or a candidate or a treasurer would do it. And so the requirements that we were originally handed was build our back office system online, which is completely counterintuitive to how maybe a treasurer expects to use the system, how they expect to file, how they expect to be able to enter data. And when I say that, I mean in the sense that when they use it, there's certain validations, certain terminology that KREF internally was used to that maybe the end user may not be accustomed to. And then also the structure. So for instance, in the system that Carlos talked about with the FEC, the treasurers, they can just enter, treasurers or candidates, they can just enter their receipts, but they don't have to attach it to a report until the time that they go to submit. Whereas in order to maintain backwards compatibility, the way their system was structured before is you have to have a financial statement first before you can put receipts on it. And so there wasn't really a way for us to be able to say, let's just build a system where they can enter receipts, and then at the time they submit, then they can associate those receipts with the report and just submit, as if the receipts could be somewhat orphaned and attached to a report later, because we had to support all the legacy data that came into the system. So we couldn't deviate from the original structure that was there.
And the systems are a little quite different as well, because the filers have an off-the-shelf system which was downloaded onto their computer. So all of their contributors and all of their expenditures, they're all listed on their computer, and they can reuse them. And some of the differences is they have a reporting cycle, end date, a start date, and an end date. So they can go ahead and submit a report anytime. And if something's wrong with it, or they receive the transaction or a contribution after the fact, they have to amend their report and then add that to the amendment and then submit it again. And that's some of the things that we couldn't do here in Kentucky because of legislation or regulations that allow the state to have to file between a certain window. And so there are certain differences that we couldn't just pick up that code base and use it for this implementation because it is different.
Okay. Thank you, Senator. Representative Heath.
I'll be brief. I was filing electronically before it became law. And my wife was a treasurer, and she liked filing electronically. And we had to rent the program. We had to pay a fee for the program. It worked great. And we thought, well, when this comes along, now we get the benefit of filing electronically free. It'll save us some money. But can't say that this program has worked great. Her stress level goes way up every time her reports due. And God bless her, she's threatened to quit several times, but we don't have a good replacement for her, so she muddles through it. You mentioned the forum with the treasurers. My suggestion would be put some of your people in KREF's office and field some of those phone calls, listen to the treasurers as they're calling in live with real problems, and you will find out real quick where the glitches are. Thank you.
And I've asked them to do that, actually. I've asked them to come over and sit down with my administrators and just experience their workday and the calls they get, and that I thought would help them learn, what needed to be done. So thank you for bringing that up.
Now it's on record.
Thank you.
Representative Minter.
Thank you, Mr. Chair. Representative Heath asked one part of my question, which was, to take it to the other end, were treasurers, candidates, people who actually use the system consulted at the time of the development, and have they been in the room in real time on deadline when everything starts to go wrong? But it sounds like the answer to those questions is no, right?
Correct.
Okay. Secondly, why? It's a really simple question, but the one thing that drives you crazy, no matter what type of system you're using, is when you're trying to get something filed, uploaded, etc., and it crashes or becomes unavailable. And particularly, we're on statutory deadline. It's one thing if I've got to submit something at work, a report for work. It's quite another if you're bound by campaign finance laws. So why does the system go down or become unavailable at the moment that is utterly predictable, a stressor point on deadline?
So part of that is just, I guess so when we first started building this out, we did not realize that there was that 2-day gap between this is when it's due and this is basically the grace period. So our initial assumption, or what we collected, was that they would be able to file and submit at any time. So that came afterwards. So basically what happened is we have all these users trying to access the system at the same time, and then it basically overloaded the system. So we made resource adjustments to be able to handle that, so that some of those processes that were chewing up a lot of resources or causing a bottleneck have been changed and addressed, so that we can handle a heavier load, especially during those critical times.
Mr. Chair, if I can ask a brief follow-up.
You may.
To ask the question that's probably on everybody else's mind, we have another filing deadline coming up. What's going to happen? What can we expect? If you fix some of the bottlenecks, are we going to be good to go? Are we still going to have unavailability or slowness or crashes? What's going to happen?
So what I can tell you is we have made changes to be able to address those, and we'll make sure that we're monitoring during that time, so that if anything does happen, we can respond quickly.
Okay, just to clarify, you've made changes since we filed the 60?
That is correct.
Okay, thank you. We'll look forward to seeing that result.
Okay.
Thank you, Representative. Representative Tate.
Thank you, Mr. Chairman. So in your presentation, you talked about that you were going to implement different or new project management methodologies. Can you describe that for us, please, and let us know how you think that that's going to improve the process? As well as, do you have documented test scripts for each one of the milestones that would help you make sure that you're meeting the requirements for each one of those milestones?
Yeah. So just to, I guess, address the first part of that, or maybe the second part, so the documented test scripts, we do have test scenarios that are documented. So one of the things that we started doing is including those test steps in our letter of acceptance when we do a release. So each release, we do a letter of acceptance with a partner that says, here are the items that are in this release. And then we started including the testing scenarios and also involving them in that. So we've always involved them in the testing, but we just want to make sure that we are following the same script as they're following, and that it's meeting the needs of really what they're looking for, what we're trying to resolve. And I apologize, I forgot the first part of your question.
The project management methodologies, the new project.
Okay. So we use an agile approach, and that's not changing. But one of the things that we are doing is setting it up in such a way that we can get on the same ticketing system that they use. So before, we did have a ticketing system for them to manage tickets, and then we had our own ticketing system. So that created problems because trying to keep the two in synchronization was extremely difficult. And so one of the things that we're doing is adding a way for them to have access to our system. That way we can work off the same plane, and as soon as something's resolved, they'll get immediate notification. They can look it up without having to send us an email or ask a question. So as soon as something's resolved, they'll be able to reach out to that candidate or that treasurer or whoever's calling them so that they can see it immediately.
If I may ask one more question. So in response to that, yes. So the ticketing system that you're talking about, there's an acceptance part in that as well?
There
Okay,
is.
Great.
Yes.
Thank you. Thank you, Mr. Chairman.
All right, thank you. Senator Nemes.
Yes, so let me clarify this. When you started the project, we're all complaining about that you didn't talk to the end users, the treasurers, which needs to be done. You all were doing, I think what you were told to do by KREF is taking care of the legacy system, assuming that then when the information was put in, it would take care of the new system that replaced legacy. Is that right?
That is correct. And just to clarify, I just want to, so when you say taking care of the system, do you mean maintaining the old system or?
Well, I assume you're making a new system.
Yeah,
You
we're
just
making a
took
new
the
system.
legacy and took that information and put it in
That
the new
is correct.
system. And the part about the treasurers was not ever looked at yet.
That is correct.
Okay, thank you. Representative Graham.
I've been sitting here and I've listened to my colleagues, and I'm a little bit older than most of them, not all of them, but most of them. And so as I asked this question, you may have addressed it earlier. How many states have you done this Besides, you talked about the Federal Elections Commission. Have you done this in other states? And have you been successful in working in those states?
Well, one of the things that I think we didn't address with Senator Southworth is we are a Kentucky-based company. Our parent company is the company that has presence in various states doing various services, e-services. Our goal is to provide electronic services for the governments in all states that we have contracts with. So we are a Kentucky-based company. We do work here as our team here has not done development in any other states. So the parent company, while they have presence in Michigan for their electronic filing system and did have presence in the federal space, that presence was different from this one. This is an online presence. That presence that they had there, or the system that was built for them, was a back-end system, but it included what we call a thick client application, which is an application or a system you can install on your own computer and not be in the clouds per se, or in the web sphere where you just go to a browser, connect to it, and do your work. That brought a higher level of security needed to be able to manage a system like that. So when we first came up and presented in front of the committee, that was some of the challenges of having to create that account to make sure the system knew who you were, who you said you were, before actually giving you access to the data. And so to answer the question, we, a Kentucky-based company, no, we have not done this system in any other states.
Well, let me follow up, Mr. Chairman.
Please,
more question.
one quick.
Well, I promise you.
Yes, please.
So we just talked about our reports, which are due pretty soon.
Yes.
Is there a possibility that you can have someone within the building that can help the agency if there is a glitch? Because we've talked about it, but no one asked the question, is there a possibility of collaborating so that these reports can come in and we can do them, and our treasurers are not pulling their hairs out because they are having problems inputting the information, or it's not allowing them to put information that normally would be requested, such as, information that you have to put in, like spouses, for example.
Right. Absolutely, Representative. I will say, and I'm not one of those that blames COVID for everything, but the last couple of years, because of COVID, things have been virtual. So we weren't able to really go into the office, or if there was, there wasn't enough staff, or we don't know. We weren't made aware that there were staff in the building. Our assumption is, like everyone else, the world was working remotely as we were. So those last two, yes, it is absolutely possible, sir. And we will.
Thank you, Representative.
Yes, sir.
Senator Thayer.
Mr. Chairman, just a brief statement. First of all, like Representative Heath, I used the old campaign toolbox electronic filing system, even though I wasn't required to do so. It was clunky and hard to use, but it's better than what we have now. And it was ancient technology. Ancient technology. Second of all, I feel compelled to let the members of the committee know that just during the time that we've been here, I've had 3 other executive branch agencies reach out to me and tell me that they have issues with Kentucky Interactive. Now, that's not the topic for today, but I do think it undermines their credibility to be able to handle database issues like this. And I'm going to reiterate that I think it's time for us to make a change, halt the implementation of the bill, and start over. To quote the late, great John Lennon, it'll be just like starting over. And that's what I think we should do.
Thank you, Senator Thayer. And the last word will be Representative Duplessis.
Well, good. I'm going to be the devil's advocate. I'm probably, other than the folks at that table, one of the few people in this room that's actually written computer code. Fortran, C++, so it's not probably the same thing you're using, and I'm terrible at it. It's extremely difficult. One little change to something in your code requires a complete debugging of the code. And I don't know if this committee understands, like I do, how a change when you're doing computer code is not like a change on a concrete job where you got to move a footer or a foundation. It's literally, it can debug, it can cause bugs in the entire code, and you're starting from scratch many times. So I'm not saying they're right or wrong in what's happened here, but I have a little bit of empathy knowing if you get that many changes, how difficult it would be to make this work. So we need to have some understanding what happened that first 9 months. Where was the communication breakdown? Was it just because Kentucky Interactive didn't do a good job, or was it because COVID made it really tough to get folks in the same room and we need a little grace? I'm not saying that's what we need, but we need to keep some of these factors in. COVID and code writing is just not the same as other problems that we see. And I think it's clear to the people at the table, though, the time is now to fix it.
Thank
And
you, Representative Duplessis.
We need to finish that. So thank you, Mr. Chairman.
Salient final words. Truly, November meeting, whoever's chairing that, that'll be the last regularly scheduled interim joint committee meeting, and it's a fish or cut bait meeting in my view. So thank you. That's all. We have 8 or more, 9 administrative regulations that have come before us. Normally I would not do this, but you've all had those regulations for a number of days. I will just ask, are there any questions about, we have people in the audience that have been patiently waiting, happy to answer your questions. So if you would say which regulation, and then I'll ask them specifically to come to the table. Senator Southworth.
Mr. Chairman, these look nearly identical. It's the KR 101, KR 2, 102, and 3015, the leave requirements.
Okay, if personnel would come up and respond to that.
Good afternoon. I'm Rose Holbrook, the Assistant General Counsel at the Personnel Cabinet.
Good afternoon. I'm Alan Hurst, Acting Executive Director of the Office of Employee Relations within the Personnel Cabinet.
Okay. So, if you all could respond.
Yeah, I believe Senator Southworth, you said you had questions about our leave regulation changes?
Yeah, I'm in section 12 on the blood donation leave. We're adding a section here that says you can't get time for initiating or attempting during a lunch period. I'm wondering, normally it's 4 hours, so it normally makes sense people schedule it either in the morning or afternoon, and I don't know that everyone, I mean, there's been telecommuting, what in the world is really a designated lunch period anymore, but, you know, we don't require them to not vote during their lunch period, and we don't require, so I'm just trying to figure out why we adding absentee ballots here by mail. It doesn't take 4 hours to do that, but they get 4 hours to leave. And blood donation, you know, they got to eat food, sit there and be watched, and then go home. They're puckered out, and I'm just trying to figure out why we're adding this, if there's a reason.
It's basically a clarification. We did have some employees that had proposed taking their lunch hour as part of the blood donation period, but historically with any type of leave that we use, you cannot utilize your lunch period along with any period that you take leave. So it was just simply a clarification because we were having those questions come up.
Okay, so currently let's say somebody takes their lunch at noon. They could not take their blood leave from noon to 4 or from 8 to noon. Give me some kind of an idea how this is different than what we're doing, because it seems different.
So in practice, the way we've always administered the reg is if my lunch hour is 11:30 to 12, I would take my lunch, and then I could leave and take and donate blood after that. And correct me if I'm wrong, Commissioner Bailey. So that's how we've always administered it. But we did have questions, so our hope with the reg was just to clarify, to quelch the questions that you cannot actually take the blood leave period during your lunch. You can't. So that's how that works now.
But it'd be adjacent to. Okay, right. That makes way more sense then. Thank you.
Yes.
All right. Thank you. Members, are there any other questions about any of the regs before us that we are considering? If there are no concerns, these will be allowed to go into effect. Seeing no comments, we are adjourned until the next meeting, which I think is the last week of October, but I think the 25th. But in any way, check your email. We are adjourned.